A new study is out and it shows that patients in Canada who do not speak the same language as their doctor face higher mortality rates, and they also frequent hospitals more. The study shows Anglophones face this in Quebec and Francophones in the rest of the country, highlighting the critical need for bilingual healthcare services around the country. Let's go now to Dr. Laura Sang, family doctor in the Greater Montreal area. She provides us with her take. Hi, Dr. Sang. Welcome back to the program.
Hi, thank you for having me.
First things first, your reaction to this study that says, yep, if you're not getting care in your first language, could lead to some negative outcomes. Well, what's your take?
So I'm not too surprised by that. I think that it's super important to have, a common language when you're trying to get health care, especially when you're very sick. It can be very stressful. It's hard to come up with the words and the ways to express yourself when you're not feeling well. So, I think that it's very clear that you need to speak the same language as your doctor to be able to communicate what's going on and really capture those nuances and help refine your diagnosis.
And, to me, if someone said, if you're not speaking the same language as your doctor, that can create confusion. And I'd buy that. But when it goes down the list where it leads to more hospital visits and higher mortality rates, that to me is just a little bit surprising. Why do you think that is? What are the things that happen if you're not able to perfectly communicate? How do you think that leads long term to a higher mortality rate?
So I think, there's a lot of factors that are at play here. If you don't speak the same language, there might be some cultural barriers that are at play. There might be some hesitation to interact with the healthcare system. It might be harder for people to, be able to get in, to use the, phone lines like 811 and whatever to actually get an appointment in the first place. And then, if they're postponing getting care, once they get to hospital, they're in a worse place than they would have been if they were able to consult earlier. If you don't have family that also speaks the language, you don't have anyone to advocate for you when you're unwell. Mm-hmm. And I think that, during a hospital stay, it's normal for other issues to come up. So if you're not able to communicate that to your nurse or other people from the treating team, it can kind of snowball from there.
And how do you think a patient should handle this? I'm just trying to think of a situation where a patient realizes that their words are not getting through. And maybe it is the case of an Anglophone and they're in some part of Quebec that doesn't have the greatest English healthcare services, and they just know something's being lost in translation. What would be your suggestion to a patient who's faced with that?
So, it helps if you're a little bit technologically savvy. I tend to use Google Translate a lot with my patients if there is a language barrier. I try to ask more, closed-ended questions, yes or no questions that can make it easier to answer. Ideally, if you're in a hospital, you should be able to have access to a translator, and that's especially important for getting things like consent for procedures, discussing things like level of care. But I think as a patient, it can be challenging, and I think it's really the job of the healthcare team to try to, offer the patient the support that they need. Mm-hmm. I think it's a lot to put that on the person, but if we are trying to do that, I think, having access to some of those technologies like Google Translate and other things can be a great tool to help in the absence of other people that can advocate for you.
I'm just thinking about my own experiences in the Quebec healthcare system because that's what I can draw on the most. And of my family members over the last few years, I had two parents that both became ill over the last few years. And we were able to get care, and my family doctor's Anglophone, and I've been able to get care in this province in English. But I wonder, what's your take on how much Anglophones can access services in their own language in healthcare in this province?
So I think it's variable. Obviously, if you leave Montreal and you sort of go into the countryside where there are very few English speakers, it might be more challenging. I think within the city center of Montreal, there's a very good amount of options. But I think that what I see this as is that we need to promote as much bilingualism as possible, that knowing more languages is always better and can only increase access to care.
We're with Dr. Laura Sang, family doctor in the Greater Montreal area. Dr. Sang, and correct me if I'm wrong, sounds like you're an Anglophone, or I don't know, how would you describe yourself? Are you an Anglophone?
Yeah, I'm an Anglophone.
Is there any, like, when you have Francophone patients, right? And is there any different dynamic between you and your Francophone patients versus you and your Anglophone patients?
Yeah, I would say that there are certain differences. First of all, the way, language is such a powerful tool for sharing culture. So the way that people will express the same concern, I find varies between my Anglophone and Francophone patients simply because of the language that's used, the kinds of expressions and things that they'll say to describe the same sort of problem.
Oh, so interesting.
And I know that not just from, Anglophones in Quebec, but any sort of marginalized group, when they speak to me, they're coming to me with the past experiences that they've had in the healthcare system. So if they've had, adverse experiences, it might be harder to open up. It might be harder to talk about certain problems, more sensitive issues, things related to sexual health, etc. So, I do notice differences, and I work as hard as I can to provide culturally competent care to all of my patients based on their background and their individual needs.
And of course, the study that we started talking about off the top here looks at Francophones in the rest of Canada, Anglophones in Quebec. But this does lead me down the path about newcomers to Canada, right? And if English or French is not your first language, you're struggling as a newcomer in this country. Any special things that you keep in mind when you're dealing, let's say you're providing healthcare to someone who doesn't speak English or French very well?
So I know that in Montreal, particularly in the East End, there are a lot of clinics that will, see refugees, asylum seekers. So I think it's important that, people who immigrate can be made aware and informed of where they can get care, because those locations tend to have translators on site. They're more set up to accommodate people. But, depending on the context that someone has immigrated, I always try to do a good sort of psychological screen to see how they're doing, because it can be a huge shock coming here, especially depending on the context from the place that they left originally. And I think that it's just important to try to establish that rapport, and, that's where having a steady family doctor can be very helpful, that you can get to know this person over time, and as they trust you, they can open up to you, and you can get to some of these core issues that may not have been addressed for many, many years.
Any core issue we didn't address in this interview? Anything you want to touch on before I let you go?
I think that, there are always going to be barriers to care, and I think that through policy and promoting as much diversity in our healthcare system as possible, we're going to do a better job meeting the need of the many different patients that we're going to see.
Dr. Sang, we'll leave it there. Thank you so much for your time on this Holiday Monday.
Thank you again.
That's Dr. Laura Sang, family doctor in the Greater Montreal area.